Hello, my name is Dr. Diwan S. Raja. Today I will discuss a few multiple choice questions on cardiology. Let's start. A 60-year-old man with long-standing mitral stenosis presents with progressive fatigue and exertional dyspnea. He has bilateral lower limb edema, ascites, and jugular venous distension. His echocardiogram revealed severe mitral stenosis with right ventricular dilatation. What is the most likely cause of his symptoms? A. Right heart failure due to pulmonary hypertension. B. Left ventricular systolic dysfunction. C. Acute mitral regurgitation. D. Pericardial effusion. E. Cardiac tamponade. So, what is the right answer? He has fatigue, exertional dyspnea, history of long-standing mitral stenosis, jugular venous distension, ascites. So, answer should be right heart failure due to pulmonary hypertension. A is the answer. Right heart failure due to pulmonary hypertension. Question number 2. A 34-year-old woman presents with progressive shortness of breath, fatigue, and palpitation. She had a history of rheumatic fever as a child. On examination, she has a loud, fast heart sound, an opening snap, and low pitch diastolic murmur at the apex of the heart. Her echocardiography shows mitral valve area of 1.2 centimeter square and left atrial enlargement. Which of the following findings is most likely to be present on her ECG? A. ST segment elevation in anterior leads. B. Right bundle branch block. C. Atrial fibrillation with left atrial enlargement. D. Delta wave. E. Left ventricular hypertrophy. So, which of the following finding is most likely to be present on her ECG? Answer should be C. Atrial fibrillation with left atrial enlargement. Left atrial enlargement due to mitral stenosis. Okay. And as a complication, we'll get also atrial fibrillation. So answer should be C. Atrial fibrillation with left atrial enlargement. Question number 3. A 45-year-old man with chronic mitral stenosis presents with sudden onset right-sided weakness and slurred speech. His vital signs are stable, and auscultation reveals a diastolic murmur with an opening snap. A non-contrast CT brain reveals an ischemic stroke. What is the most likely cause of his stroke? A. Atherothrombotic plaque rupture. B. Cardioembolism from left atrial thrombus. C. Intracranial hemorrhage. D. Carotid artery dissection. E. Rupture of berry aneurysm. So this man has stroke and features of mitral stenosis. Okay, so his answer should be this B. Cardioembolism from the left atrial thrombus. B is the answer. Due to mitral stenosis, there is left atrial hypertrophy. Blood cannot go from the left atrium to the left ventricle smoothly, so there will be formation of embolus that will go to the brain and will lead to stroke. And this person has hemiparesis or hemiplegia and he has slurred speech. This is due to embolus from the left atrium. Question number 4. A 32-year-old pregnant woman in her third trimester presents with sudden onset dyspnea, orthopnea, and pink frothy sputum. On auscultation, she has a loud S1, an opening snap, and a diastolic murmur. Echocardiography reveals severe mitral stenosis with pulmonary edema. What is the most appropriate immediate management? A. Diuretics and beta blocker. B. Mitral valve replacement. C. Percutaneous balloon mitral valvotomy. D. Intravenous thrombolysis. Our answer should be percutaneous balloon mitral valvotomy. Percutaneous balloon mitral valvotomy. Question number 5. A 50-year-old man with long-standing mitral stenosis presents with progressive dyspnea, ascites, and bilateral leg swelling. On examination, he has elevated jugular venous pressure, hepatomegaly, and pedal edema. An echocardiogram shows severe mitral stenosis, right ventricular hypertrophy, and tricuspid regurgitation. What is the most likely underlying cause of his symptom? A. Pulmonary hypertension leading to right heart failure. B. Left ventricular failure. C. Aortic regurgitation. D. Acute coronary syndrome. So answer should be pulmonary hypertension leading to right heart failure. This is the presentation. Okay. So right-sided heart failure, pulmonary hypertension following a large left atrium due to mitral stenosis. Question number 6. A 65-year-old man with a history of aortic stenosis presents with progressive exertional dyspnea and syncope. Echocardiography reveals severe aortic valve calcification with extension into mitral annulus. Which part of the cardiac skeleton is most likely involved in this pathology? A. Right fibrous triangle. B. Left fibrous triangle. C. Annulus fibrosus of aortic valve. D. Tendon of Todaro. E. Fibrous ring of the mitral valve. What should be the answer? This person has severe aortic valve calcification. So this part of the cardiac skeleton is most likely to be involved in this pathology, that is the annulus fibrosus of aortic valve. Annulus fibrosus of the aortic valve. C is the answer. Question number 7. A 45-year-old man undergoes cardiac MRI due to frequent premature ventricular contractions. The MRI reveals anomalies in the right fibrous triangle. Which of the following structure is most closely associated with right fibrous triangle? Okay. So what is present in the right fibrous triangle, or what is passing through the right fibrous triangle? A. SN node. B. AV bundle. C. Right bundle branch. D. Left bundle branch. E. Purkinje fiber. So what structure passes through the right fibrous triangle? Answer should be AV bundle. That is the AV bundle. Question number 8. A 28-year-old woman presents with palpitations, chest radiograph, and anxiety. So palpitations, chest discomfort, and anxiety. So a 28-year-old woman presents with palpitation, chest discomfort, and anxiety. On auscultation, Here, a mid-systolic click followed by a late systolic murmur at the apex, which becomes more prominent when she stands up. What is the most likely underlying mechanism of her condition? A. Rheumatic valve disease. B. Mitral valve prolapse. C. Infective endocarditis. D. Papillary muscle rupture. E. Mitral stenosis. This is a young lady. She has palpitation, chest discomfort, anxiety, and she has mid-systolic click followed by late systolic murmur at the apex. So answer should be to the young lady, and it is very common condition. There is mitral valve prolapse. That is the answer. This prolapse happened due to myxomatous degeneration of the valve cusp base, myxomatous degeneration. Question number 9. A 30-year-old woman with a history of mitral valve prolapse presents with fever, night sweat, and weight loss. Blood culture reveals Staphylococcus aureus, and echocardiography shows a vegetative mass in the mitral valve. What is the most likely diagnosis? Okay, viral myocarditis, rheumatic heart disease, Liebman-Sack endocarditis, infective endocarditis. So, what should be the answer? Blood culture reveals the bacteria. Okay. So, there is infection by bacteria, and echocardiography shows vegetative mass in the mitral valve. So, answer should be D. Infective endocarditis. Infective endocarditis. Okay. Question number 10. A 68-year-old woman presents with progressive dysphagia to solids and liquids along with exertional dyspnea and lower extremity edema. A chest X-ray reveals widened mediastinum, and an echocardiogram shows a large left atrium compressing the esophagus. What is the most likely underlying cause of her symptom? She has dysphagia, exertional dyspnea, lower extremity edema, widened mediastinum, large left atrium. What should be the answer? Is it esophageal cancer, achalasia, severe mitral stenosis with left atrial enlargement, D. Jenker's diverticulum, E. Mallory-Weiss syndrome? So answer should be what? Okay. So our answer should be severe mitral stenosis with left atrial enlargement. C should be the answer. Severe mitral stenosis with left atrial enlargement. Okay, this happened because due to large left atrium, it will push the esophagus against the vertebra, so there will be dysphagia. And that's all about the MCQs in Cardiology 1. These are the answer 1 through 10. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.